someone wanted to know about volitional, which is voluntary ptosis. And you can just do this on yourself. You can just close one eye. So just close one eye, that's a volitional ptosis. And the way you're doing that is by activating the orbicularis to close the eye. And then you can learn to just do it passively so it doesn't actually look like it's constricting. So the way to tell that this person is trying to fool you with this volitional ptosis is, first of all, you have to do the motility. And that's a really great test because they think you're testing their eye movement, but really you're looking at their lid. Now you have to test their eye movement anyway, but really you're looking at their lid. So when you look up, it's going to be very hard to maintain the ptotic lid when you're looking up. So because you can't dissociate the two eyes. Now you can not look up, but we'll be able to see it in the control eye. So under the lid, if you make them look up, it's going to be hard to maintain the volitional ptosis, and it'll start to show the twitching fasciculations in the orbicularis, showing that they're actually volitionally doing this. The other thing you can do is you can look at their brow. So in a normal person, when you have a ptosis, you're trying to use your frontalis to raise it up. So instead of using your orbicularis to close it down, you're using your frontalis to raise it up. And so in patients with volitional ptosis, the brow is either at the same level or it's down. And then when they look up, it'll stay down. So the finding of the brow being depressed also suggests that it's a volitional ptosis. And then there are other things we can do to try and distract the person to see if it'll go away just by talking to them. And it's very difficult to maintain this over time. The other thing about the ptosis is you can just raise it up and then let go, and it's going to volitionally go down versus a real ptosis. As soon as you let go, it just falls down immediately. So in the volitional ptosis, there might be some delay before they can get their orbicularis to fire. And you can sometimes put the bell of the stethoscope on top of people's eye, and you can hear the firing of the orbicularis, so like a low rumble in a volitional ptosis. In a real ptosis, of course, you would hear nothing because nothing's firing. So you need to be able to tell the volitional ptosis. And if you want to try and practice on yourself, you can see all of the things I just showed you by just pretending to close one or both eyes. And then you can try these tricks out on yourself or your partner.